Hello, everyone. Welcome back to another episode of the Endurance Physios Podcast. I'm Dr. Sam Rockwater, joined with my co-host, Will Gonzaba. How you doing, Will?
Doing great, Sam. How are you, man?
Oh, living the dream one day at a time, baby. Today's episode, dry needling. I know people have heard about this. It's a popular topic, kind of a hot topic in physical therapy, becoming more of a, I don't want to call it like a commonly used tool, but definitely a lot more providers are doing it. The rules have kind of loosened a little bit on physical therapists being able to dry needle. But anyways, we're going to dive deep into that today.
Yeah. I'm glad that we chose this as a topic, man. I mean, it's so prominent, and it's just I feel like it's becoming more and more popular in practices and people requesting it. And so I'm glad that we're able to get on here and kind of clear up what it is and like who will be good candidates for it. I also think it's interesting too because I know you've practiced dry needling for a long time. And have been trying to convince me to take the course, and I have yet to take the course. Not because I'm against it,
Someday,
I
Will.
just haven't done it yet. So I think that it'll be interesting. I'm interested to pick your brain on the topic and learn more about how people who this works for and other aspects of it. So let's get into it, Sam.
Yes.
So why don't you just start explaining it to us? So what is dry needling?
Yeah, I'm actually, you know what, Will? I'm gonna throw you a curveball. I'm gonna ask you what
I don't
you're
like
dang it, I
curveballs.
hate you right now.
Hit me.
I'm gonna throw you a curveball. What has been your prior experience with dry needling, and how do you understand it to be? Like, what do you understand it to be? And then
Sure.
then I'll answer the question, what is it, and when, and all that stuff. I'll give you a little history about it and everything. So go ahead.
Yeah. So when
Let's throw a curveball first.
No, yeah, of course. And actually, I've worked around it a lot. I've just never done it. So one practice that I worked at in Louisiana, we had several therapists on staff that were dry needling certified. But at the little satellite location that I was at,
Nice.
I was not that. So when we thought that people would benefit from dry needling, I would refer them to that clinician for the session. They would see them do the needling thing and then kick them back over to me, and we would carry on from there. And they would do that more or less depending on the results and what was needed. Familiar with recognizing what conditions might do well with this or respond well to it, but it just has not been within my own wheelhouse to apply the technique. As an athlete myself, I've had it done. I'll get a quad tendinopathy thing that'll rear its head every now and then. And so the PT that I've worked with in the past, he'll do some dry needling into it. So, for me, the way that I've explained it to patients is, now I'm kind of nervous because I haven't explained it in so long because we don't do it.
No, that's okay.
No.
Will, you're not certified, so it's no big deal. So
no, it's cool.
I'm just more curious. So fire.
Yeah. So what I will tell people is that, especially if we're referring people for tendon injuries, is hey, we're going to use this. Basically, they're using this very fine needle. It's the same needle they use for acupuncture, and they're going to get it into this part of the tendon where you're feeling most of the pain, kind of explaining it like a trigger point release, right? So they're going to put it in here, and then that's going to stimulate. The idea is for it to stimulate a new healing process within that tissue because of the localized damage there, right? And I know that is one way it can be applied. There's a lot of other ones. You can be hooked up to eStem, this and that, but that's about the extent that I'll explain it to them and say, hey, that provider will explain it to you more. So that's the way I've been dishing it out. Do you approve of that?
Okay. Yeah.
Okay.
Yeah.
Sure, man.
I think that's a very good general starting point, and I think you hit on a really important thing, that there's so many different things that you can do with dry needles. So, so hopefully, Will, by the end of tonight, or by the end of this podcast, you'll be convinced that you need dry needling. That's my goal here.
Let's do it.
So let me back up. Let me tell what it is, and then kind of dive a little bit into it. So dry needling is very similar to acupuncture. It uses the exact same needles. So it's a solid monofilament needle, which means that there's no hole in it. It's a solid needle. Essentially, you're in the medical field. If you puncture the skin with a needle and then you inject anything, that's called wet needling. And so dry needling essentially just means that you're poking the needle in, but you're not injecting anything into it. That's my understanding of wet needling versus dry needling. Essentially, the biggest difference is the theory of how we're using those needles. And so with dry needling, we're using trigger points. You can use like fascial points. In acupuncture, they are using other points such as like G points and meridian points. And the theory behind what they're doing with those needles is different. And so that is the main difference between dry needling and acupuncture. As licensed physical therapists, we are able to do dry needling. We are not able to market it or call it acupuncture. So two very kind of distinctive points there. So the difference is the theory and where we're putting in the needles. There
Okay.
are a lot of points over the course of the body where there is an acupressure point, there's a meridian point, there's a chi point, there's a fascial point, and there's a trigger point. One of those examples for everyone, if you go to your elbow and you kind of feel where like that little bone is popping off there, and then you go 2 fingers down towards your wrist, and kind of you'll feel almost like a little canal and a little groove in there. And if you push in there, most people are pretty tender. And so that point, for example, is a chi point, a meridian. It is also a fascial point. It's a trigger point. So it's all the above, because there's only so many ways that you can mark it on the body. But in physical therapy, we will use those as dry needling, trigger points, or a fascial point, because that is westernized medicine. Essentially, you can use needles, and it's actually kind of funny that you say this, that you were saying that like there's multiple ways to use it, because I literally just explained to a patient today about how we're doing much different needling. So I use dry needling for a variety of different things. I will use it for trigger points. So if somebody has like a knot in their muscle, I'll be able to drop a needle down into that muscle. It'll have what we call a twitch response, which is where essentially it kind of like releases. It's more startling than painful. And so you can drop in there, get what we call a twitch response, which is where it essentially releases for trigger point. You can also do it to try and essentially heighten the sympathetic nervous system, or you can do it to downregulate the sympathetic nervous system. And so if you want to try and heighten or get the muscle contraction, and I've done this with athletes before they go out onto the field to warm up for like a game, essentially you drop the needle in, you do what's called pistoning, which is where you take it up and down, up and down, up and down a few times, then you pull it right back out. The idea is that the body sees that as a noxious stimulus and responds to it by kind of heightening and kind of being surprised. Think of it as if you're sleeping and all of a sudden the fire alarm goes off, right? Since you're like, whoa, what's going on? And then all of a sudden it turns off 20 seconds later, right? You're kind of startled and like you don't really like, what? Right? And then all of a sudden, you try and go back to sleep, and now it takes you a long time to go back to sleep, right? So you can do it to essentially excite a muscle. You can do it to kind of down-regulate a muscle. So by doing this, you can put that needle in just a little bit, and then you can just let it sit there. And you can let it sit there for 5, 10, 20, 30 minutes. I've had patients sit there for 45 minutes before. If they're really heightened up and their nervous system is really ramped and going, and I'll essentially just drop that needle in there, and I'll say, hey, I'm going to turn off the lights here. Here's a little bell. Like the door will be cracked. If you need anything, just holler and or ring the bell, right? And then I'll go and I'll treat another patient in that time, and then I'll come back and take out the needles, and half the time they're sleeping, which is great because that means that they're fully relaxed. And then the other half of the time they're just kind of like totally like a mush, like, kind of like a mush, I don't know, mush poodle, right? um,
Right, right.
but but that's another way though that you can essentially like use needling. And I literally today talked with somebody and I'm like, hey, we've done the down regulation dry needling before. Today you have a giant trigger point in your right calf and we are going to go after it, and it's not going to feel as nice and pretty as last time, right? And so we took four needles. We put 4 needles into the medial gastroc, kind of like all along,
Mm.
essentially like right along in that nice, wonderful knot that he had going on there. And I mean, it released, and it was great. I mean, I tried to do like a little ischemic pressure, which is where you just push your thumb into it first. It wasn't responding to that, so I took some needles, and it responded really well to that. Definitely was jumping a little bit. He was definitely jumping a little bit when we were doing that, because it sometimes isn't the most comfortable thing, at least
Right.
initially when those knots are getting released. But it definitely like feels better afterwards. Afterwards, you can, I mean, the muscle felt really good. Um, so two like very different ways of using it, and like I guess I mean I use it all the time, but it's a tool in a tool chest, right? And you got to know when to do it and how to do it, how to use
Sure.
it.
So yeah, man, just like everything, right? You know what? So just to make sure
Yeah.
I'm following you correctly on this. So okay, the trigger point usage, I can very easily see that, right? Like you're kind of sticking it in the
Mm-hmm.
tissue where it hurts, where the restriction is. In terms of stimulating a muscle or down regulating a muscle, did you say that you
Mm-hmm.
elicit those responses primarily based on the depth at which you're putting the needle in to the tissue?
It can. Yeah, I
Okay.
mean, the deeper you go, the more the more muscles you're going to hit, right? And the more tissue you're going to essentially what we call create a lesion in. And
Hmm.
so as you create a deeper lesion, you're going to have more of a response to it. Um, in order to excite a muscle, essentially you drop the needle in, you piston it or move it up and down
Okay.
multiple times,
Got
then
it.
take it out right away.
Okay. Got it.
So
So
the needle is
that's how
in
you
for
do
no
that.
more than maybe 10 seconds. Yeah, the needle's in for maybe no more than 10 seconds versus down regulation. I'll have the needle in a minimum of 15 minutes. If I'm doing like a true down regulation, I'll have it in for like 30 to 45 minutes,
Okay.
sometimes even an
Gotcha.
hour. I
Okay.
mean, yeah,
Just depends, right?
yeah,
Depends on
that's
how
kind of
people
like the
respond to
biggest
it.
difference. Yeah,
Yeah.
yeah, and it all
Okay.
depends on what you're doing, right? So, I like to think of it, um, it's like a crescent wrench, right? You can use it to tighten a bolt. You can use it to loosen a bolt, right? And those are
Mhm.
going to have very different things. And same with the needle, right? Like you can use it to tighten, you can use it to loosen, right? A muscle. And but at the end of the day, like the mechanic, aka the PT, has to know how to use it and when to use it, right? You're not going
Sure.
to use a crescent wrench for everything in a car, but at times, like when you need to get a bolt loose, like that's the tool you need. And so, that's kind of how I view it. Not everyone's going to get dry needling. I do use it a lot in my practice because I think it helps, and it's a it saves my hands, but b
Hmm.
also too, you can get and release some really deep muscles really easily that you couldn't otherwise get with your hands.
Yeah. Honestly, that's what the
So
one thing of everything with dry needling that is most appealing to me is just saving my hands because my hands are going to shit. And it'd be like, oh, this would
yeah,
probably be a lot easier if I could just like drop a needle in here. Like I could just physically see that would help a lot. Um,
look at
but
this. You're already
yeah,
talking yourself into it. I love it.
well, you know what which I think, early in my career, which I think this is very situational, right? So I don't think this could be a blanket statement, but being like a young PT working with a lot of experienced PTs, this is at the clinic that I've referenced before, and not being dry needling certified at the time, like I kind of I kind of didn't like. Well, I didn't like that I wasn't and they were, but it almost felt like, oh man, like if I couldn't figure out what was wrong, oh, like they must just need dry needling. You know what I mean? That's kind of the vibe that the clinic had, was like, oh, if you people who
Yeah.
do not have dry needling, if y'all can't figure it out, send it to us and like our needles will fix them. Right. Like definitely sometimes that was like that
Mm, not
it
quite,
helped.
but
Right.
yeah.
Yeah. Right. Like that's not right.
Yeah.
And then you didn't get that across at all, but just, I worked in a clinic that was like that for like a year, right? So I think kind of it left like a
Mhm.
little bit of a bitter taste in my mouth after that, right? Because I kind of felt like at least there and maybe at other clinics, like maybe they were a little too needle happy. You know what I mean? Like everyone got needles and like that
Yeah.
was the cure all drug. But like you said, man, like it's a tool, right? And it can be very useful when it's used appropriately, right?
Oh yeah, absolutely. I mean, I will almost always test them in some way, shape, or form, needle them and then retest them, and or use exercises as well afterwards.
Mm-hmm.
So essentially what I'm trying to do is I'm trying to create some sort of stimulus with that needle, right? Whether it's a down regulation, up regulation, or getting rid of a trigger point, and then I will try and use an exercise to essentially try and reinforce that, right? So if I want them to kind of calm down, I'll work more towards like an isometric, right? If I
Mm-hmm.
want them to get going, I'll use more of like a plyometric or like a heavy, like quick concentric, eccentric kind of thing, right? I'll give you an example, like hamstrings, for example, right? If I want to try and elicit a response in the hamstrings, I'm going to drop the needle in, piston it a few times, take it out, and then I'm going to have them sit on the edge of the table and kick into a little ball, kick into like a stability ball, back and forth like as fast as they can to try and elicit more like hamstring contraction and hamstring activation. On the opposite spectrum, when I want to downregulate them, right? I'll drop the needle in, just leave it there, no pistoning, no nothing. I'll just drop it in, leave it there, and then I will essentially have them do like a bridge or something similar, right? Like where it's very much like isometric, and have them do like a bridge and hold, right? For like 30 seconds, 60 seconds, right? Something where they're essentially kind of calming that muscle back down, but still trying to make a little bit of like a reaction. And
Sure.
I think you kind of hinted on it too, like, um, a lot of therapists, unfortunately, use it as like I won't call it evaluation tool, but like, I don't know what else is going on, and so I'm just going to use dry needling to see if this helps. Right? They're
Mm-hmm.
kind of using
Mm-hmm.
it almost like the kitchen sink. Is that kind of like
Mm-hmm.
the feeling that you
Yeah,
got at that clinic?
definitely.
Yeah. Um, and I think that I understand where they came from, with that. I've taken, um, dry needling courses from two different companies. I'm not going to name the companies, but one was significantly better than the other. After that, and I took the first company, was like all trigger point dry needling, um, and I 100% fell into that same kind of trap.
Mm-hmm.
I ended up, and I just remember I was like, man, there has to be more ways to do needling because people rave about it, and dropping the needle in, pistoning it, and then taking it out does not feel comfortable. I can tell
Right.
you that, especially
Right.
like to my
Right.
own, like to me personally too. I was like, this isn't comfortable. Like, how do people love this? Like, I mean, I'm a glutton for punishment. I'm an endurance athlete. Like, I swam. I spent 4 years counting pool tiles, as I was swimming, right? Like, I'm a glutton for punishment, but like not that much, like I was trying to
Right.
figure out, how people would use this, and I knew that there had to be some other way of doing it. I ended up taking, another dry needling course through my residency program, um, and I was just like, I just remember like that first day when I took the course, I was like, what? There's so many more ways to use dry needles than like what I know, and I'm about to learn all of them, and this is great, right? That was like my first thought. But there's so many different ways that you can use those needles. The gauges of needles, the length of the needles, all make a difference. If you Certain brands are also very different, right? So you have, um, like for example, there's a was it Kwadu? I'm gonna mess this up. Anyways, it's a needle out of South Korea. It is a unpolished needle. So what that means is, on a microscopic level, it looks like a little saw,
Oh.
right? So the needle is not polished down and thinned down, so it looks like a little saw. So that muscle is really good for tendons because you're going to drop it in there. You can twist and rotate that needle, and you can tighten up that tendon, and then you can twist it back the other way and release it. So it's really
Mm.
good for getting, a good stimulus out of a tendon. However, I'm not going to use that same needle when I'm trying to downregulate because it's going to be painful going in and painful coming out because it's a
Right.
sawtooth kind of like pattern, right? There's
Mm-hmm.
another, needle type. It's called the sarin needle. They're high. Yeah, I know. There's it's called the Sarin needle, which is another brand, and it is highly polished. So it goes in like butter, and it is also silicone coated, and so it slides in really easily. Not great to use for tendons because you can't grab anything with it, but it's
Mm.
really good to use to help downregulate people. And through the second course, when I was like learning about all this, and I'm like, whoa, I had no idea. I was just ordering a box of needles, and I had no idea what the difference was. Right. And I think there's a lot of physical therapists out there who don't have that training or that understanding that, like, oh, the brand of needles that I choose is actually really important for what I'm trying to do. Right. Or,
Mm.
hey, there's more than just this one technique to do. I don't need to piston everyone and make them really pissed off and mad at me, when, you can use other techniques to essentially make it feel better.
Sure,
But
man. That's really interesting with the needles. I had no idea the differences at all, but that makes
yeah,
plenty of sense.
neither did I
So that
until
makes
that
plenty of
second
sense.
course.
Yeah, I'm glad you saw the light. Um,
Yeah.
okay, so if you are if you I guess are someone who's interested in getting this, when is it a good time to do it? Or maybe too, if you're a clinician that practices it, like, so maybe addressing it from both ends. So like if you're someone who's dealing with an injury, when would be a good time to seek out dry needling? And then if you're a clinician, when should you be dipping into the toolbox to access this tool and apply it to your clients?
Yeah, those are great questions. I think the best thing, um, I should say, like, to answer the question just point blank, I've used needling for maintenance. I've used it for acute injuries. For example, I've used it. Somebody got an ankle sprain, and I literally needled their TFL like a day later.
Hmm.
Or TFL, ATFL, excuse me, which is essentially a ligament in the front of the ankle. I mean, maybe I was kneeling up by their hip
Yeah,
too, but
yeah, it's
no.
fine. Yeah.
I've had a patient get an ankle sprain. Literally 24 hours later, I've literally been sticking needles in there in their ankle to try and essentially help with some of that swelling and edema control, which is another use of needles, that a lot of people don't know, is that you can actually poke a whole bunch of needles around, and it can reduce swelling, which is very counterintuitive,
Hmm.
but it can work,
Interesting.
and it
Yeah.
does work. Yeah. So I've used it from very acute injuries. I've used it on people with
I'm, I'm
chronic low back pain as well. What's that?
I'm envisioning like sticking a bunch of needles into a very swollen ankle and then squeezing out all the fluid and just like it draining out of the ankle. That's how it works.
That's
Okay. No, that's
that's
not how it
exactly
works.
how
That's
it
not how
works.
it works.
So
That's not how it works.
that that's definitely
Uh,
not how it works. But it's it's a good visual. Um, but yeah, I've used it on people who have chronic low back pain. I use it a lot in maintenance for people, and that's probably where I use it the most, is maintenance, and to try and essentially, like, if they are not responding to traditional manual therapies and or exercises, that's when I will use it. I would say that's probably the most where I use it. The second most is probably when people are in acute pain. So I have a lot of people too. For example, like, I have a runner currently who has some low back pain, and it kind of is a little bit of a roller coaster. And so we've used it to essentially try and help modulate some of that back pain when it does kick in.
hmm.
Um, that is what I would say. Like, I mean, I've used it all the time. In terms of, you know, patients, like, when to use it or that kind of thing, like, they can really use it anytime. I think clinicians use, like, to dip into your toolbox and use it. That's a really interesting question, um, and one that I'm trying to, like, formulate probably like a good answer for. I would say, that you should definitely use your knowledge, your physical therapy evaluation skills, 100%. Every time a patient comes in, you should be reevaluating them, to a certain extent, right? And trying to figure out what's going on. I would use that, use needling as another tool to essentially help with treatments, but I don't think it should be used as an evaluation piece, if that makes sense.
Yeah, it
I know
does.
some people who will use that, who will like throw needles in like a muscle and see if like there's trigger points and use that as an evaluation. I think that's a very, very poor use of dry needling and
Yeah.
not not good.
Mm, yeah. So, but that
I
makes
would
sense. Because
say good.
go ahead. I was just gonna say, it makes sense. Your response to that part of the question makes sense because I do think it is, even though I don't needle, like it is a hard question to answer because of its wide uses, right? Like it can be used in acute injuries, it
Mhm.
can be used in chronic injuries, it can be used in ligaments, tendons, muscles, fascia, all of the above. And so, yeah, like
Yes.
it's hard. I guess it
Yes.
is hard to say, like, yeah, this is only used within the first 10 days or only afterwards because it's not like that. This is some tools are like that, but this tool is not that. So yeah, I get why as a
Yeah.
clinician it might be hard to say when for sure is when you should use it. What about as you're applying it? I guess this would apply for. I think I know what you're going to say for patients as well. Okay, because um, let's say like someone has a let's say chronic calf pain, okay, and the PT that they're going to see has
Hmm.
been needling it for I don't know, let's say a couple weeks, and it's not really moving, it's not really getting any better. Like at a certain point, and then as the clinician, like at a certain point, is it like not going to respond to like when do you decide, hey, this is probably not going to respond to dry needling? Or is that just so
Yeah. I
rare
mean,
that like you haven't even crossed that clinically?
it's.
Because
I mean, that's
some other
yeah.
techniques you're like, hey man, I've been doing the instrument assisted stuff into your calf. I've been mobilizing your ankle, blah blah blah. I've been doing this for like 8 weeks and it's just not getting any better. So like when you just
Yeah.
when with needling, is there a threshold with needling that does it differ from other techniques we might use in the clinic?
Um, I always tell people that needling is not like a magic pill. It's not a magic cure, um, and that it does take time and like oftentimes repeated sessions in order to make a difference. But so does
Mm-hmm.
exercise. So does
Mm-hmm.
manual therapy techniques. Um,
Yes.
so does anything else really that you're going to do in physical therapy, right? There are some things, and depending on how I use the needles can like make a bigger effect or a lesser effect. And that's one thing that I've learned. I've taken 4 dry needling courses at this point. Um, and so from over 2 different companies. And so I feel like I have a really good idea of when to use needles and when not to, and like how to use them best and appropriately. And I think that really didn't sink in until I probably took like my second or third course of dry needling. Um, Given that my first course wasn't the best course, um, and I definitely recommend like the company that I got second for sure to people. I know we've talked about it off air a few times about that company, um, and like going to that company to like, hey, if you're going to take course, take it from this place. I know it's inconvenient, it's not there, but like it's worth it.
Mm-hmm.
Um, and I feel like that is I providers need to understand how to utilize that tool, and I think that's probably the biggest thing. There isn't really like a time when you like, oh my god, like this is the time for needling, or a time where it's like, okay, this is not like needling is not working, like let's just abandon it. um I think when I had, don't get me wrong, I had a ton of those on both spectrums where I needled the crap out of people and over needled them, and then I've done it where I've under needled them. But I think the only way that you really learn is through experience, which is really tough to say, especially like as patients and athletes who are listening to this are like, what do you
Mm-hmm.
mean? It's to learn. But just like any other technique, right? And any other medical professional, you go into the ER, right? Do you want the nurse who just graduated school, or do you want the nurse who's been there for 20 years? You want the nurse who's been there for 20 years, right? I know I do, right? Like,
Right.
give me the grouchy old nurse who's been there for 20 years over the nice, sweet, first year, nurse. Um, but I think it's more about providers learning how to use the needles effectively and efficiently, um, and learning about dosage. So how many needles to put in, where to put them in, how many to put in each muscle, what parts of that muscle are really important. Like, do I hit that trigger point? Do I not? Do I try another, like, this is down another rabbit hole, but like you can do it locally, you can do it regionally, you can do it segmentally. So locally is like you put it right in that calf. Segmentally is like you go along like that nerve in the like upper leg, right? So like you go like in the hamstring along that nerve. And then segmentally is like you would go all the way up into the low back and you needle the low back as well as
Mm.
the calf. So there's a lot of different ways that you can needle that. Hopefully that kind of gives you like a better answer. I know it's a very gray area, but I don't think patients should shy away from it. I don't think athletes should shy away from it. I do have athletes who literally like they just say, "Hey, I," they'll make an appointment or whatever, and they're like, "Hey, like once a month, I just need needles," and then they'll come in and they'll be like, "Yeah, like here, and here is tight. Like, what do you think?" And I'm like, "Okay, cool. Like, let's needle you," and then boom, they're good for another month. So I think there's a lot of
Yeah.
different ways to use it, and I think like athletes definitely should use it. Practitioners, medical professionals certainly should use it. But I think appropriate training on the medical professionals is critical and vital to the patient having a really good experience with dry needling, because there have been a bunch of people who I've also treated who, when I say dry needling, they're like, no, 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 I've done that in the past and it hurts. I'm like, no, this is much different. We're going to downregulate you. I'm not going to piston the crap out of
Yeah.
you, and
Yeah.
so I think there's, yeah, it's ambiguous
No,
and
no,
a lot of gray
no,
answer,
no,
but
no, man. No, I
hopefully
mean,
that makes
the
sense.
last point is, it makes plenty of sense, and everything you said makes sense. But I think it's not everything you always say makes sense, but everything you just said makes sense. I'm teasing you.
Oh,
I'm
thank
teasing
you, Will.
you. Okay, I'm teasing. I'm teasing.
Thanks,
Okay,
Will.
no, 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 no. What I wanted to say, that's an important point though, because it's the same thing where it's like it's important for people to recognize that all dry needling is not the same, or all techniques are not the same, and the way that practitioners are using it are not the same. It's the same thing with PT, right? When they're like, "Oh, I tried PT in the past and it didn't work," and you're like, "Okay, well, let me
Yeah,
guess what they did," right? And it's kind of the standard stuff.
yeah.
So that's an important thing to keep in mind, right?
I've heard
So
that story way too many times.
yeah, right. Me too. Story of my life. Um, and I think too, like you're the big point that you're making is just that there is a little bit of gray area, because providers, once you are using this tool, like it does take some time to refine whatever new practice it is that you're doing, right? And figuring out the dosage
Yes,
behind what you're doing,
yes,
and the pattern recognition behind what people are going to respond well, or not respond well, right? And you do those same things as a clinician using your hands or whatever other techniques you're going to do anyway, right? So there's just a little bit of time that comes into that. And then once you get it down, then you're like, oh, like you just know right away, hey, this case is going to do great with it. This one's not. This is exactly how we're going to treat it, right? So it just takes some time
yeah,
to refine all of that. I know
yeah.
you mentioned that last story resonated with me, because my wife, um, she had this really bad metatarsalgia, so like foot pain, a couple of years ago. This is when we were living in New Orleans, and I wasn't going to work on her, and I was like, you should go see whatever other PT. It's
Love
just one
it.
of those things. She always asked me to work on
Yeah,
her.
yeah,
Like
yeah.
I'm like about to go to bed. I'm like, dude, no. Like you should ask me 2 hours ago.
I'm
Anyway,
I'm glad I'm not the only one who gets that request at like 9 p.m. at night.
yeah,
So
I
thank
know,
you.
dude. Like it's not always no, but just right now it's no. So anyway, she goes to see this other PT, and dude, her calf was like super locked up too. Like she would like try to do a calf raise, and like you could see it just like not move up and down at all. Like it wasn't contracting. But anyway, the dry needling, while it was painful, she had it all the way through the calf, maybe the Achilles, through the arch itself, and it responded so well to that. So it can definitely be super 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 helpful, and you can, from what you're describing of applying those needles through different patterns, not just at the source, it made a big difference for her case.
Hmm.
So something to be mindful of for sure. So I know that most of what we are, well, not most of, our entire show is about endurance athletes and sports in some way, shape, or form. So for endurance athletes specifically, how would they benefit from dry needling?
Multiple ways. It is the long answer short. The biggest thing that I would say endurance athletes, like how they would actually benefit from it, is probably the recovery side. So kind of like that down regulation of the nervous system. I know I've worked with a few professional triathletes before where I would go over to their house at 8, 9, like 8:30, 9 o'clock at night. After, whatever they're training, or sometimes 7 o'clock at night. And I would um, do like a little like recovery protocol that I've learned through some of these courses. And essentially I would put the needles in and then just like exit the room for 45 minutes. um, Watch a YouTube video or whatever, hang out on the phone or whatever, just kind of let them be. And, I come back and, they, take out the needles, and then, they're like, I text them the next morning. Hey, how's it feeling? Dude, I got the best sleep ever, like, um, and so, that's really helped them sleep, was through like that recovery protocol. I think the other way that, like, obviously, that's a very specific way too of like getting having like a benefit, right? You have somebody, in this case, I was traveling to their house, and it was an evening appointment where, a lot of PTs are not going to travel to travel to patients' homes, and B, they're not going to do it, especially at 8 p.m. at night, right?
Right.
And so, that's not, potentially feasible, but probably not for most people. I think for a majority of the endurance athlete population, the biggest thing is going to be to try and help release some of those knots that you haven't had, which unfortunately can be a little bit more on like the startling, or, some people will call it quote unquote painful side. It's more startling than anything else. Um, but that is probably like how endurance athletes say, I got this knot in my calf and I just can't get it out. The classic foam roll doesn't work. And, I know people use lacrosse balls. It's not my favorite thing in the world to use. We can go down that rabbit hole another day of why I don't like them. But they'll use, like a tennis ball, lacrosse ball, still can't get it out. They'll try and use a foam roller, still can't get it out. They'll try and pin it against, like, I've seen people use PVC pipes before to try and get like knots out and stuff, and they still can't get it out. That's one way where a lot of athletes can really benefit from that. Um, I would say, in general, another way that athletes could definitely benefit from that dry needling would be if they have any sort of like acute injury. So, for example, mountain biker, falls, you know, bangs up their knee or whatever, get that same with the swelling thing, right? So to get a little swelling protocol in there, I would say that's another really good way where, if people, if you do have an acute injury, can take care of it. But there's so many ways of using dry needles. And I think, um, the more as a practitioner, the better you're able to help your athletes in different ways. And that's really been like my whole goal, my whole career, is to like accumulate tools and then learn how to use them really, really well. Right. My goal is to be like a master body mechanic, and in order to be a master mechanic, you have lots of tools, right? And you know how and when to use them. And I think that's probably the biggest, like most important thing for practitioners to know, for endurance athletes to know, is find somebody who's been needling for a while, not just, somebody who's right away out of school or whatever, right out of, the class or whatever. Now, I know, Will, like, you haven't had dry needling certification training yet, which is totally
Mm-hmm.
fine. Because you got to be comfortable, and you got to be willing to put needles in people, which, as weird as that sounds, like that, there are some people who just don't like doing that. But as you learn and use that new tool, right, you become better and better and better at it. And that's I think another thing too, is endurance athletes, just like they're honing their craft and training and like learning through their training, and all of a sudden now they're figuring out what works food wise and nutrition wise, and like what works for like electrolytes, what works for like what works in the bottle, what do you eat, like all that stuff, and those endurance athletes are constantly evolving and changing, right? So are practitioners with dry needling. And I think that's something super important to note too, is that like they're all practitioners are trying to get better, just like the endurance athletes that they're treating.
Right. Yeah, absolutely. Yeah, I think,
So
no, good, always a good point, right? There's always, I mean, most practitioners, the good ones at least, are going to look at it like a lifelong skill, right? And I know that you can just look at the snapshots of our careers, which I guess would be like entering the midway part of them by now. Um, it evolves every year, and every year you get a little bit better, just like the athlete ideally gets a little bit better every year that goes on. Um, I think for me, I am, well, I'll say that I'm really excited. Our staff PT, he just took an upper quarter dry needling course, I think, and now he's going to take lower quarter
nice.
this weekend. So I'm excited to be able to have the resource for
Sweet.
our clients without having to actually go take it. I'm not against taking it. I will take it at some point. It's just been more of like a
Got to
life
get you
thing.
in, Will.
But, you know, it's one of those things that's it's like, oh man, like this is going on that weekend, this is going on that weekend. But I think that just shit is going to be going on every weekend, so you just sign up for it, make it happen, and get it done.
It's
But
got to go.
I will do that.
It's got to
I'll do it
go.
at some point, hopefully this year. But at our
There you
practice, we
go.
will be offering it, so I'm excited for that.
There you go. Nice. I like it. I think it's a great tool to use, and I think once you do get certified, Will, I'm sure you'll love it, and you'll be like, man, why didn't I do this years ago?
Throwing needles left and right.
Yeah, yeah. You'll just
Behind
be
the
throwing
back.
needles in people all the time.
Oh
Awesome.
yeah.
I love it. Any other questions about dry needling for me, Will? While we're on the topic.
No, I don't think so, man. You did a great job explaining it
Cool.
and the theories behind it. So I hope that it was as insightful for our listeners as it was for me.
Yes, absolutely. And also too, I'm gonna see if down the road too we can. I have a few people who would be excellent, who actually teach some of these courses, and so maybe down the road we can interview one of them, because that would be
That'd be
wonderful.
cool.
That would be a
Yeah,
very
that'd be
deep
cool.
dive episode, but that would be awesome. So
I'll
we'll
do my
see.
homework.
Um, yeah, get certified. That's your homework, Will. We're calling you out.
Yeah.
All right, everyone. Well, thank
All right,
you
man.
guys for listening to another episode of the Endurance Physios Podcast. Uh, as always, please like, subscribe, follow along, anything, download, whatever form of media you are using. Will, hit me up with your Instagram. Where can people find you?
You can find me at my personal account at Will Gonzaba, Gonzaba, or at my company's page at Almost Park Physio. That's OLMOSPARKPHYSIO. What about you, Sam?
Awesome. You can find me on IG at the Endurance Physio. That is two E's, double E. So THE, another E for endurance, ENDURANCE, Physio, PHYSIO. So the Endurance Physio with two E's there. Awesome. Thank you guys. We will see you next time.
Thanks, y'all.
Peace.